Poliomyelitis, a vaccine-preventable disease. What is polio? Well, polio is caused by the polio virus. The polio virus is an enterovirus, meaning it infects the enteric system, or the intestines and the stomach. It is spread through the oral fecal route, through unsanitary conditions mostly. It is a virus, meaning that antibiotics will have no effect on treating it, and it is very hard to treat. Viruses work by inserting their DNA or RNA into your own cells and taking over the machinery to make new copies of itself. Polio mostly affects children. In adults, it's pretty much asymptomatic, meaning it doesn't have symptoms showing in 95% of the cases. In children, though, it most often causes a terrible form of the disease called paralytic polio, which affects either the legs, causing paralysis and inability to walk, or it causes paralysis of the nerves, which are responsible for helping you breathe, resulting in the need to be put into an iron lung. So, famous people that had polio. Franklin D. Roosevelt, President of the United States. He suffered polio as a boy and was paralyzed for the rest of his life. There are very few images of him actually in his wheelchair because he did a very good job of hiding it from the public. He did not want to appear weak. But he did not have any use of his legs. Donald Sutherland, an actor and father of Kiefer Sutherland, another actor, suffered polio as a young boy, but he did not experience any long-term lasting side effects, and had just a mild gastrointestinal form of the disease. And the Emperor Claudius of Rome, the records show that he probably suffered from some polio-like disease, which left him disfigured and unable to move properly. So, what happens when somebody gets polio? Well, it starts off by entering through the mouth and heading down the throat, down the stomach, into the small intestine, where it starts to make more copies of itself. As this happens, more and more viruses spread into the blood. From the blood, they continue to replicate, and then they move into the central nervous system. Now, the central nervous system is the spine and the brains. It gets there by traveling through the peripheral nervous system, which is the nerves which reach out to your skin. Once it enters the central nervous system and reaches a certain threshold, a certain number of viruses, it reaches a certain level. That's where we see paralysis happening, whether it's in the legs or in the lungs. Here we see a picture of patients in an iron lung, which was built to help them breathe because they couldn't do it on their own with the paralysis of the lungs. And once the virus reaches a certain point, it starts to be shed in feces, and that's how it spreads from person to person. There is no cure for polio, and no treatment for it because it is a virus. It has a 25 to 75% mortality rate. That's both before the vaccine was introduced and after, but luckily now the vaccine prevents you from getting it in the first place. So, the polio vaccine is effective in preventing polio. It's given as 3 doses soon after birth. We see it here as the inactivated poliovirus vaccine, or IPV. The first dose at 2 months, the second dose at 4 months, and the third dose can be anywhere from 6 to 18 months, and a fourth follow-up dose at 4 to 6 years. There's a little bit of leeway in this period, but the booster helps reach the most effective immune memory response. The vaccine was invented by Jonas Salk in 1914, and This graph here shows this vaccine when it was invented and how it really drastically dropped the number of cases. So the vaccine is really helpful. They were very high, the cases here, before the vaccine. Here's the introduction of the inactivated vaccine, and the cases dropped drastically in a short amount of time. And with the introduction of the other vaccine, the live oral vaccine by a man named Sabin, the numbers dropped even more. The problem with the live oral one is that it can't be given to everybody because of your immune system. And then we see here it says last indigenous case, and that was when polio was eradicated in the United States. And we see posters of the polio vaccine campaign. It was very extensive, and it really helped to prevent polio from being a serious disease in childhood anymore. So, some vaccine myths. Do they cause autism? No. Studies have shown that there's no link between vaccines and autism, and the few initial studies that did have been retracted. Their sample sizes weren't that good, and they just weren't very scientifically accurate. So, new studies show there's no link. What about immune overload? Well, research indicates the immune system can handle a lot, and the amount that's given in the vaccine only uses about 0.01% of your immune system, so immune overload does not happen. Can you get polio from the polio vaccine? No. Well, the United States switched back to the original Salk vaccine, which is an inactivated polio one. So the virus in the vaccine is killed by chemicals, and it cannot come back to life and cause disease. So, what's the point of this vaccine? Well, it's leading towards global eradication. As you see, in 1988, a lot of the world was infected with polio, the dark gray regions, compared to 2008, where there are 4 countries there. Currently, there are 3 countries left in the world with wild polio cases, and we are working very rapidly to remove this terrible childhood disease, and it's all thanks to the polio vaccine. So it's very important to get vaccinated. References for the images and the information.